We're live from Senate Chamber 6. It's Senate Night Live. Okay, enough jokes. Welcome, folks, to Labor and Health Senate version. We're going to hear 4 bills this morning, but first we'll go over the rules of decorum because we have a very large crowd here this morning and I want you all to behave. And we have a very rowdy committee who I expect to behave. Now, rules of decorum, you've all got them. It's all important that we treat each other with civility, that we're nice, that we don't criticize each other. We're here to debate, hear testimony, but I think we can all be kind. And if you have cell phones, I would ask you to turn them off unless you have a deep desire to buy donuts for Monday morning's meeting. If your phone goes off, we will have donuts. Okay? And the person whose phone went off last year has not come to a meeting yet, but he will eventually. Okay, we have 4 bills in front of us. We have an hour and a half to do them, or a little short of an hour and a half. They're all very short bills. We'd like to get through them in a hurry. So if it's been said before, say it the second time quickly. First bill for our consideration is Senate File 5, Organ Transplant Recipient Protection. This bill came about as the committee discussed during the interim that we have a bill protecting, or we have a statute protecting organ transplant donors, which I believe we did last year. And somebody brought up and said, we don't have anything protecting the recipients, and that's the origin of this bill. And it's a very short bill. It's a 3-pager. Pretty much we just inserted organ transplant recipient everywhere where we had organ transplant donors. It's a pretty straightforward bill. It outlaws any discrimination based on being an organ transplant recipient. Straightforward, straight through. It takes effect July 1st, 2024. With that in mind, that's the bill. Okay, so let's hear some testimony. If we got anybody from any agencies that would like to comment on the bill. I see Department of Health snuck in the back room. I heard that if we said that there's going to be some head shaking out there. So yeah, I'm from an agency. Yeah. Okay, no agencies. Anybody else in the room wish to comment on the bill? We're off to a really slow or a really fast start. Committee. Nobody online. Yeah, is there anybody online? Nobody online either. The rest of the world is asleep. Okay. Committee, let's close public testimony. Move the bill. Bill is moved by Senator Barlow, second by Dockstader. Okay, we can go through page by page. Won't take long. Descriptions on page 1, as I said earlier, it just protects the recipient. Page 2, just saying there can be no discrimination based on the manner of being an organ transplant recipient. That finishes up page 2. Page 3 just describes what the covered person is. Other than that, pretty straightforward. Any additions, suggestions, comments? None. Let's go ahead and do the bill, please.
This is a roll call vote on Senate File 5, Organ Transplant Recipient Protection. Senator Barlow. Aye. Senator Bouchard.
Aye. He's walking in. Senator Bouchard, this is the organ transplant bill. Let's go ahead. Everybody else will come back to Senator Bouchard.
Senator Dockstader.
Aye.
Senator Hutchings.
Aye.
Senator Bouchard. Aye. And Chairman Baldwin.
Aye.
Okay, we have 5 aye, Mr. Chairman.
Okay, Senate File 5 passes the Committee of Labor. Do we have a volunteer to present that on the floor?
I'll be glad to.
Senator Barlow would be glad to. That one's yours. Okay, committee, that takes us.
As long as it goes as smoothly as that.
Yeah, it will, I promise. That takes us to Senate File 6, Nursing Home Administrators Temporary Licenses. And I know that we've got the Hospital Association and nursing home folks are across the hall. Why don't we hold that one off we'll hold that one for a minute. Yeah. Let's give him a minute. See, let's jump to Senate File 7. Behavioral Health Redesign, Vulnerable Adults. These first 3 are all committee bills. We'll come back to that one next. Behavioral Health Redesign, Vulnerable Adults. This came actually from the Mental Health Task Force. The Mental Health Task Force, through this bill, is simply adding vulnerable adults to the list on the behavioral health priority list. And it talks about adults with severe mental illness, variable adults. If you look at the definition in section 35, vulnerable adults are listed as being folks with physical disabilities or mental disabilities. And this would simply add them to the priority list for mental health care. With that's the bill. It's a straightforward bill. It's pretty straightforward. With that in mind, do we have any agencies? Department of Health, I know he wants to comment on this one. Welcome, Franz.
Morning, Mr. Chairman, members of Senate Labor. My name is Franz Fuchs, Policy Analyst, Department of Health. Didn't have anything specific for you, just wanted to stand by for any questions you might have on this or behavioral health redesign generally.
Any questions for Mr. Fuchs?
I don't know,
Senator
if it's our
Duxton.
director or you, how did we reach a point where we didn't include these folks into the statute? What brought us to this point?
Go ahead, Franz.
Mr. Chairman, Senator Dockstader, I think this is a very relatively small population that DFS deals with. I think this bill is kind of a belt and suspenders approach. Those folks would have likely met one of the higher tiers anyway. This just explicitly spells out that they are included in that specific category.
Thank you.
Senator Hutchings.
Thank you, Mr. Chair. Franz, thank you for coming up to speak to us or answer questions. When I look at 3520 102A, Romanet XVIII, it describes vulnerable adult there. And it mentions that the very last word is mental disability. So I'm wondering why we need to add this again to our statutes when it's already there.
Mr. Fuchs.
Mr. Chairman, Senator Hutchings, again, I think, the vast majority, if not all of these people would be covered by one of those categories that exist. This is, again, just clarifying, we're not going to exclude these people if for whatever reason they don't necessarily meet the other criteria. Again, kind of a belt and suspenders type approach.
Go ahead, follow up.
But if the belt and the suspender is already in the statute, what are we gonna do that's different? It describes a vulnerable adult means a person, blah, 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 and the last words have a mental disability. So I don't see a need for this. And I don't understand why we'd wanna add them again when they're
Mr.
there.
Fuchs.
Chairman Baldwin, Senator Hutchings. So I think the Title 3520 is specific to DFS and is not relating to the behavioral health redesign. And so what this bill does is sort of folds in that definition into specifically to the behavioral health redesign eligible populations. So there already is the belt in the statute, or adding the suspenders is what this bill does. But the Title 3520 section is a DFS-specific definition that wouldn't necessarily automatically qualify people for services under the new behavioral health redesign system.
Okay. Further questions for Mr. Fuchs? Seeing none, thank you. Stand by. Anyone else in the room wish to testify to this bill? Anybody online? Nobody online?
There is no.
No one online.
There is no.
I wonder if anybody's watching us. You suppose, anyway. Okay, committee, that closes public comments. Anybody wish to move the bill? Move the bill by Senator Barlow. Anybody wish to second it? Second? I'll second. Okay, let's talk about the bill. Senator Barlow.
Thank you, Mr. Chairman. So one thing I don't recall from, this is an interim committee bill, so give it the opportunity to be heard on the floor, I think is acceptable. I don't recall the discussion we had about why we dated this 2026. Why it says until 2026 in the text. And that maybe that has to do with the behavioral health redesign or the rollout, but I think that's July 1st, 2024. So anyway, I'm just curious about the 2026, and maybe I should have asked Mr. Fuchs while he was here, but do any of my colleagues recall that? Thank you.
I can, and I believe it's because there's a sunset date, if I believe in the redesign bill, to come back and assess this. Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. So I think it has to do with that whole section of bill that, remember that well, I mean, it was the one that I tried to kill, and it had those sections that were, we did a lot of redesign there. Remember, we had to change the sunset on that one too?
Yep.
And I think part of it was this language never got fixed in that. Remember, that thing created a bunch of mess, and now we're trying to clean that up. So that's what I think is going on.
Mr. Fuchs, would you like to come set us all straight? Because you're younger and have a better memory than all of us.
Mr. Chairman, members of the committee, again, my name is Franz Fuchs, Policy Analyst, Department of Health. Mr. Chairman, there is no overall sunset date in the behavioral health redesign, but there is another bill, House Bill 5, which is now failed in introduction, is now resurrected as Senate File 115. That was basically looking at, in the indigent general access clients, striking the insurance requirement or uninsured requirement, and that had a sunset date of 2026. And I think perhaps in the committee process, the two sunset dates were added simultaneously to the two bills, but I don't specifically remember why, the reason why the sunset exists. So I think it's just to kind of see how things play out with eligibility, and we can report back to these committees and let you know how many people fall into each of these categories.
If I'm not mistaken, I believe in the bill, it's not a official sunset date, but I believe there is, like you say, I believe there is a report back date that we require a report back to the committee, if I'm not mistaken, back to the interim committee. I believe. Anyway. Okay, thank you, Mr. Fuchs. Coming up. Further comments, committee, questions, thoughts?
Mr. Chair,
Go ahead, Senator.
I'm not lost. I'm just like concerned because I know I have vision problems. I do. But I keep seeing this. I went to 35-1613 and I see in there under A, I see adults with severe mental illness. So I'm just wondering again, what's the need? If it's in there in those two places that I've mentioned, I just don't get it. So somebody can help me get it, so I can vote yes on this. Yeah.
Yeah, hold, yeah. Go ahead, Senator
Chairman,
Dodd.
I think it comes back to my original question, what brought us to
in
this point? She's tracked it down. and says we got it in
35-613,
statute.
it's there.
I guess we have to
And then if you go,
understand what this does.
yeah. you go here,
We'll
that's
just, should we
where
take a
I put the
timeout?
definitions. And then if you go to 35.
While we're searching, Mr. Fuchs, any clarification? Let's, go ahead, Senator Bouchard.
if you go to
Mr. Chairman,
this
from
one,
what I understand,
there,
is this
it's like,
This is in code, but it's not in the part where they need it for behavioral health. That's what I remember we talked about.
Yeah, that's my understanding.
Then, Mr. Chair, are the statutes that they're referring to incorrect? Because I see it there. So the parts where you're saying it needs to be, that's where I need to see it not there. But I'm not seeing that with the references you're giving in the bill. So if you can help me there, I will be happy to,
We want you to be happy,
well,
and we want your vision to be perfect. Senator Bouchard, go
I
ahead.
love that.
Mr. Chairman, so from what I understand, there's areas in the law that we may use it where, for instance, a police officer or someone has to use it on the street because we have a problem, they make a decision at a county level, which is totally different from a decision that's going to be made because of a behavioral health problem and how they classify it within the healthcare system. So that's why you'll see it in two different sections of the law.
Senator Barlow.
Thank you, Mr. Chairman. So, and I appreciate the discussion. When I look at the reference in here, 3520-102A18, that's a definition, as was said, under adult protective services. So this is under what DFS's responsibilities would be. And the definition is anyone 18 years of old unable to manage or take care of himself and his money, assets, property without assistance as a result of advanced age, physical or mental disability. Mr. Chairman, I would respectfully say adults with severe mental illness is not the same as what I just read.
You don't think of mental disability?
No, it's not a mental illness.
Okay.
Disability is not a mental illness, no, in my view.
And we have a lifeline came up
Thank you, Mr.
from
Chairman.
DFS.
Thank you.
Go ahead and jump in and
Sorry.
tell us what's on your
That's-
mind.
that's-
Clarify us,
that's
would you?
what-
Thank you, Mr. Chairman, members of the committee. My name is Corin Schmidt. I'm the Director of the Department of Family Services. And to Senator Hutchings' questions, the bill before you does reference the Adult Protection Services statute. And what adult protection services are, to the senator's point, is a list of kind of behaviors and characteristics that may make somebody vulnerable. But to kind of punctuate Senator Bouchard's point, that doesn't necessarily mean it's a clinical diagnosis, which is what the behavioral health, what currently is in the behavioral health reform legislation. So from a practical standpoint, what we encounter is a good number of the cases that we work with in vulnerable adults include some level of mental illness, but it may not be at the level where it's considered a serious and persistent mental illness. So we have isolation, depression, anxiety, and what we also know is that an early intervention to provide some of those mental health services will hopefully prevent unnecessary admittance into a higher level of care like a nursing home. So the goal really is to try to figure out how to keep those vulnerable adults at home. And most of our vulnerable adults are elderly, not all, but of those elderly, trying to provide some services to them so that they can continue to reside at home. This is a population that doesn't necessarily reach out very well. They do have a tendency to isolate. So when we engage with those clients, with those vulnerable adults, we want to be able, we as an agency, DFS, want to be able to make some immediate connections to mental health services as soon as we can. So this just puts it in the priority population. I think to recognize that there is a group of vulnerable adults that, if they have pretty quick access to those services, have a greater chance of staying where they want to stay.
Very good. Any questions for Director Schmidt? Go ahead, Senator Barlow.
Mr. Chairman, is Director Schmidt available to present this on the floor?
Yeah, I would give her my name tag for the day. Thank you much, Director Schmidt. Okay,
Appreciate it very much.
further comments, committee?
Thank you, Mr. Chair.
Okay, let's go ahead and vote on this bill, please.
This is a roll call vote on Senate File 7, Behavioral Health Redesign, Vulnerable Adults. Senator Barlow, Senator Bouchard, Senator Dockstader, Senator Hutchings, Chairman Baldwin. We have 5 ayes, Mr. Chairman.
Senate. We'll just walk through the bill here real quick. Senate File 6, Nursing Home Administrator Temporary Licenses. This was an interim bill as well. Let's just go through it page by page here because I have to refresh my memory. I believe that this was conforming amendments to make licenses available, temporary licenses for the nursing home administrators, because right now there's no means for them to have a temporary licensure. And that, from what we heard in testimony, there were a number of people out there that are currently undergoing certification or are taking classes or doing what they need to become licensed nursing home administrators, but because they didn't have that, they were unable to be licensed. And several people caught in the middle that weren't completely licensed, and therefore we had nursing homes that were unable to have licensed directors. And this provides a means for temporary directors. And in my mind, remembers this correctly, I believe that we have most of those things for like doctors, for nurses, for et cetera. There's temporary licensure available for these folks, and this provided a mechanism to have a temporary license to be issued. I believe there were, on page 2, it talks about valid for no more than 6 months, 2 2 separate temporary licenses is the max. On the bottom of page 2, it talks about a temporary license by training or experience in the field of institutional administration. The board determines is qualified to serve as the administrator of a nursing home that does not have a licensed nursing home administrator. A temporary shall be valid for a period established by rules of the board. Going on page 3, the holder of a temporary license shall be subject to the standards of conduct imposed on a license holder under the act. And then bottom of page 3, it just goes through what the board needs to do to develop the standards and the rules about the temporary license. And then there's penalties on page 4, a misdemeanor for anybody to serve in that capacity of a nursing home unless he is the holder of a license, a temporary license. So that what I'm seeing here is that this just provides a means for that board to provide a temporary license when there's a difficulty getting the permanent provider. With that in mind, do we have any agencies who wish to address the bill? Go ahead and come on up. And you'll probably do a much better talking about the bill than I did.
Mr. Chairman, members of the committee, my name's Emily Cromba. I'm the Executive Director for the Board of Nursing Home Administrators. I'm here if you have questions or if you'd like me to just touch on the temporary options briefly.
If you could touch on it, and I say do a better job than I did explaining it, tell us the need
Sure.
and where this bill came from.
Sure, Mr. Chairman. There are 3 types of temporary licenses this bill is trying to add. Currently, the board does offer one of those methods. However, with some different Attorney General representation, there was some question if the board had appropriate statutory authority to do so. So we are trying to remedy that piece. While we had the opportunity, we were trying to add on page 2, line 1, that would allow the board to license somebody that's met all requirements, but they're waiting on the results of their criminal background check. In line 10 on page 2, that would allow the board, and this is the one we're already doing, to let them earn hours as an administrator in training under another licensee. And while they complete their exam, until they meet the qualifications for full licensure. And so we're just trying to clearly do that in this section. And then line 17, this would be those emergency situations where a nursing home has lost their administrator, typically very unexpectedly. They have nobody to cover the home. It will take a while to get somebody licensed. So typically they're looking to have their director of nursing or maybe the CEO of that facility try to cover the home. And this would offer a temporary path for that person should they meet these requirements.
Very good questions. Senator Barlow.
Thank you, Mr. Chairman. What is the consequences for a nursing facility not to have a administrator or director? Thank you, Mr. Chairman.
Mr. Chairman and Senator Barlow, the Social Security Act requires that all homes have a nursing home administrator, as does the Board's Practice Act, and forgive my ignorance, but maybe even the Department of Health, Office of Healthcare Licensing and Surveys. So the consequence is they're in violation of multiple laws. Safety-wise, I know there's an actual licensee here who could better speak to how that might work, but they're out of compliance with multiple laws and there's not somebody serving that duty.
Chairman?
Go ahead, Senator Dockstader.
So what have we been doing to this point as far as if all of a sudden we needed coverage of a home and we don't have authority to do it? Just kind of wink and nod and say, run the place for a while? What do we do?
Go ahead.
Mr. Chairman and Senator Dockstader. So the second provision that I said we're already doing, it's what we call our provisional license right now. So it allows somebody to get licensed while they are working under the supervision of another license holder. So typically, in the cases of emergency, the only fit we found under our current rules was to let a director of nursing apply to be a provisional licensee and practice under a license holder. Ideally, with this license, they're completing their administrator and training hours and taking the test, which they don't end up doing. They just hold the provisional for 6 months until they can get somebody in. So they're using another process that's not really intended for the situation.
Thank you.
Okay.
Well, Follow up then.
Follow up.
Putting in the word temporary then is the fix we need. Go ahead.
Go ahead.
Mr. Chairman and Senator Dockstader, I sure hope so.
Yeah, okay.
From the guidance we've gotten from our advising attorneys, ideally, yes.
Thank you. And if I could, after the meeting, I got a nursing home question for you, so thanks, Mr. Chairman.
Okay. You're not going into a nursing home yet, Senator Dockstader. Senator Hutchins.
Not yet. Thank you, Mr. Chair. Ma'am, on page 2, where you mentioned on line 6, the applicant's criminal history background check hasn't come in yet. And then you mentioned for safety. Does that bother you that someone's background check hasn't come in and you really don't know what that person is gonna be like, what they're gonna do, the safety of the patients? Is that a concern with this temporary license?
Go ahead.
Mr. Chairman, Senator Hutchings, that's always a concern of a licensing board. The assurance we've gotten at board meetings when we've discussed this requirement is that nursing homes are also doing a background check. It's not the same process and theirs is a bit faster. So there's some assumption of assurance that this individual is not going to be hired with a negative report from the home.
Thank you.
Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. So let's just clarify for everyone. If I remember right, it was during COVID that we lost some directors, and that was where everything kind of fell apart. And that's what we're doing, is trying to go back and fix this so that way we don't have that problem again. So is that correct?
Go ahead.
Mr. Chairman and Senator Bouchard, yes, a bit. There is a loss. We're currently, as of this month, at our lowest number of active license holders since 2015. So there was a big loss following COVID, but we're not quite seeing the numbers recuperate from that. So it is the board's hope, as well as Leading Age Wyoming and some licensees, that perhaps having these temporary methods might help with that issue. If the statute would go through, the board is also looking at some rules changes to try to address some additional options towards licensure.
Okay, I have a question for you. Oh, okay. My question is this. If Senator Dockstader wanted to become an administrator of a nursing home,
Yes.
what are those requirements? What does he have to do education-wise, license-wise? Can you educate me a little bit and perhaps the rest of the committee?
Mr. Chairman, I'd be happy to. Currently, the rules require that you hold a bachelor's degree in any field, or it could be an associate's degree in a healthcare field for the education component. Then there's the requirement that you get at least 500 hours as an administrator in training, and the board rules do break down that it has to be in various categories to cover the full breadth of what an administrator does in their job. Additionally, there's a national exam, and it's a 2-part exam. It's the core, which is general skill set, and then the nursing home administrator specialty exam.
Okay, thank you very much. Any further questions, committee? I believe the licensing board. Anybody want to come up? Nobody here from the licensing board? Okay. Department of Health, any comments? Anyone else wish to come up and come on up? Thank you very much for your testimony. That is the hardest part of testifying, is getting that little button to work.
All right.
Go ahead and introduce yourself and
Yes, Mr. Chairman and Committee Board, my name is James Hammond. I'm a licensed administrator here in Cheyenne, actually at Polaris Rehab and Care Center. I've been in practice for about 3 years now. And I have shown up to answer questions and to get my input as well on this. I feel it's a very important bill to increase the numbers of licensed administrators within the state. As Emily stated, we are the lowest number that we have been in 6-7 years. So I think it's important.
okay, questions, Senator Barlow.
Thank you, Mr. Chairman. So part of what good administrators do is they build succession. They build the folks behind them. So, Mr. Chairman, it strikes me that maybe Romanet 2, this licensure pending completion, is a way to actually allow an administrator to have their deputy administrator start this process, so that if he's on vacation or leave or sabbatical or whatever, they can assume those responsibilities and earn credits toward, the completion and then full licensure. Chairman, so is that something that you think is one of the possibilities with this type of a bill approach?
Yes. In fact, within the last year and a half, I have trained 6 administrators. However, 2 of them have left the state. And so if we can continue to train future administrators to stay within the state and give them the opportunity to fill in as those cases arise, I think that's a great solution to this.
Very good, thank you. Further questions, committee? No further, thank you very much.
And then I can go back to the
Go ahead.
question by is that okay?
That's
All
fine, go ahead.
Let me get you off. And so we actually do an extensive background check within the nursing home as is required by CMS guidelines. However, we just don't do the fingerprinting. And so we don't do the fingerprinting part. And so the state requirement is to have the fingerprints, and so we are confident when we bring somebody into that administrative on a position that their background check will be clear.
Okay, further questions? See none, thank you very much.
Thank you.
Anyone else in the audience wish to comment or testify on the bill? Seeing none, anybody online? Still nobody watching us? Okay, public comments closed. Committee, what's your pleasure? Moved by Senator Dockstader, second by Senator Hutchings. Any comments, additions, subtractions? Seeing none, let's vote on the bill, please.
This is a roll call vote on Senate File 6, Nursing Home Administrators Temporary Licenses. Senator Barlow.
Aye.
Senator Bouchard.
Aye.
Senator Dockstader.
Aye.
Senator Hutchings. Chairman Baldwin.
Aye.
We have 5 ayes, Mr. Chairman.
Okay, that bill has passed the Labor Committee, and Senator Dockstader says he'll handle that one on the floor. Next bill for our consideration is hospital or healthcare district created entities, immunities. This is actually under my name, but Senator Barlow is the prime sponsor in my mind on this one, and he's going to talk to us about it.
Thank you, Mr. Chairman, members of the committee. So this is a bill that is something that's actually starting to occur around the state where different hospital, healthcare districts, et cetera, are working together. They're collaborating, and they are creating new entities, LLCs or corporations, to provide healthcare services. In my community, there's a hospital district that is cooperating with a county memorial hospital in another county and creating a ambulatory service. Actually, they've done so. What's unclear in the statutes is whether when they have immunity, or not just immunity from everything, but they have governmental immunity individually. But when they create another entity, even though they both own that entity, the two subdivisions of government, that third entity, it's unclear in the statutes that they have that same governmental immunity clause. So what this does is just clarify that. Now, when this came out, there were some concerns the way it was drafted. So what you'll see, so I passed out an amendment. And one thing that I think this came up in one of our future bills is I don't like references to other pieces of statutes. I don't like to have to look at a statute and then go look up what that's referring to. So when you look at the amendment, Mr. Chairman, you'll see line 2, page 2, line 4. What I'm doing is getting rid of that reference, that 18.8.301A, and then putting in the actual language that comes from that, because those are the 4 districts we're talking about. That's just me, and that's a personal preference. And when we did this and it was drafted, and we have a very fine legal staff, as you know, and they try to economize on words and use references because that's their job. I like people to be able to look at it and say, this is what we're doing. Everybody understands it. You don't have to go digging around. So that's the first one. The second one is up in the title. And this was a concern brought to me by attorneys that said, you're not granting new immunity. You're just saying that these folks are the same as the others. So it should be, they don't get special immunity. It's just the same. There's nothing added to this. So I know it's a bill title, and I know some of my colleagues get concerned about that, but I think this is just a clarification. We're not doing something new. We're just sticking with what we got. So, Mr. Chairman, if I could so I tried to explain the amendment in the bill, but as you can see, it's a very short bill. It goes into a definition, page 2 of the bill, and it just inserts this new language into that. And this is under Title I, which is administration of government, and just says, if you're doing this, and it's the same thing, that you'd get the same type of treatment under the Governmental Immunity Act as you would if you were doing it individually. So that's the heart of the bill. That is the bill, Mr. Chairman. And I stand for any questions. Thank you, Mr. Chairman.
Good. Senator, can you do me a favor, just in case there is somebody listening to us online? And just on that page 2, line 4, can you just read that into the bill so that they know what you're talking about?
Thank you, Mr. Chairman. So in the bill on page 2, line 4, there's a statutory reference and starts on 3, but Wyoming Statute 18-301A, Romanet 3. And when you go back to that, what you find is County Memorial Hospital, Special Hospital District, Rural Healthcare District, and Senior Care District. I shouldn't say, it's not maybe that specifically, but it's that set of statutes that allows them to create these entities. So we have one statute that says you can do this. What we're trying to do is insert this into the governmental immunity part so that it's clear that they also have that governmental immunity. Thank you, Mr. Chairman.
Very good. Questions for Senator Barlow? Go ahead, Senator Hutchins.
Thank you, Mr. Chair. What is this governmental immunity? I tried to look it up really quickly. Explain that to me.
Well, Mr. Chairman, I think the good senator has the green book in front of
Yeah,
her
I'm
that
trying
has
to
it in it.
find it.
That has it in it. But
Yeah,
generally,
it's like
it is,
crazy.
generally, and I guess, and there's probably attorneys in the room that can explain this much better than I, but it's generally, if you're doing duties within the context of your official duties as a, whether it's being as a physician or as a governmental entity, i.e. a county or whatever, there are limits on the amount of damages that could be awarded. So if it's negligence, that's totally different. But there are limits so that we don't jeopardize government functions or professional functions when they're doing their official duties, when they're carrying out the responsibilities they have. And that's probably a really poor job of explanation, and I see there are folks in the audience that can probably clarify that. But it's basically some protection for government and governmental employees when they're carrying out their official duties. Thank you, Mr. Chairman. Limitations. Thank you, Mr. Chairman.
Very good. Further questions for Senator Barlow, committee? Seeing none, let's move to the room. Anybody, any agencies wish to comment? I don't think there's anybody left. Is there anybody else who would like to comment? I know Senator Barlow said there's some really smart people out there. They're giggling. Would you like to clear anything? Anybody want to come up and clarify or talk, or
It'll help.
if you got a
Excuse me,
good
Mr.
joke, we
Chair.
take that. Come on up. Come on up.
I don't like vagueness.
A reluctant witness. Go ahead and introduce yourself, please.
Good morning, Mr. Chairman. My name is Beth Lance. I am here on behalf of the Wyoming Trial Lawyers Association. If I may answer through you, Mr. Chair, Senator Hutchings' question, although I believe Senator Barlow actually did a fine job. But the Wyoming Governmental Claims Act is, in fact, what Senator Barlow said it is, and it is a way in which it helps insulate government from lawsuits when government is performing its duties as required. It is when potentially employees or others go outside or beyond those duties and potentially cause harm or do something that is outside the bounds of reasonableness, such as gross negligence, something of that they may be subject at that point to a claim that has to be filed through that act. So any claim then against the government has to be filed through the Wyoming Governmental Claims Act. And then there are caps listed statutorily as to the total amount that can even be recovered by an individual in the event that they are found to have a valid claim.
Very good. Questions, committee? Seeing none. Thank you very much. See, it
Thank
wasn't
you,
that bad.
Mr. Chair. Thank you.
Thank you very much. Anyone else in the room wish to testify? Anyone online? I knew it. I knew it. Okay, we'll close public testimony. Committee, what's your pleasure?
I'll move my bill.
Senator Barlow moved the bill. Who would like to second it? Senator Bouchard seconded it. Comments, discussion, committee? We'd walk through it, but it's page 1 and 2. There, it was a short walk. Okay, no comments? Let's go ahead and vote on the bill.
Mr. Chairman, have we moved and voted on the amendment?
Oh, you're right. It's a good thing you're here, because you,
Sorry. Mr. Chairman, I'll move the amendment as presented, ask for your favorable consideration. Again, Mr. Chairman, I think the title change is just clarifying. We're not adding anything. We're just making it subject to the Governmental Claims Act, so we're not doing anything. And then the definition, as I mentioned, I don't like references. In discussing this with some of the interested folks, we're just going to put in who is eligible to, under this clause, so under this particular bill. So I hope that meets the understanding of the committee, and if I'd be glad to stand any questions on the amendment or on the bill, which the amendment basically is the bill.
any
also.
questions on the amendment? Senator Hutchings?
Thank you, Mr. Chair. Just something that kind of came to my mind, and I think it kind of flows with the amendment. I hope it does. Let's just say we have a situation like we did with COVID, where you have the US government saying everybody needs to take these shots, and then get down to the cities, the states, the towns, and you have to take these shots, and you find out people start dying or getting sick or whatever. Is this in essence saying these people will be immune because they were just doing their duty under this act, since they're now being subject to it? Is that what we're saying here in this, in the bill in a roundabout way?
Senator Barlow?
Thank you, Mr. Chairman. No, I don't think this has anything to do with medical malpractice
Okay.
or that kind of thing. This is simply can you create it, can two already authorized entities create a third organization and be covered by the same type of immunity that they would have individually? That is it. It has, I don't believe it has anything, I mean, it certainly has healthcare context, because this
Right.
isn't healthcare,
Right.
but this is for the entity. And Mr. Chairman, if I could, this is not on, but let's just to flesh this out a little further. I mentioned it's a hospital district in my community, my county, a county memorial hospital in another county, working together on EMS services. So we've had a lot of discussion about EMS and the challenges. Well, they're trying to use, their collective buying power to have a big enough system. And what they found, there's enough unclarity, lack of clarity in the statutes, that they actually went out and purchased liability insurance on the private market, which is very expensive, to cover them, when we think they should probably be covered, or we should clarify that they're covered under Wyoming statute. Mr. Chairman, thank you.
Mr. Chair, I thank
Go
you
ahead.
for that. And, sometimes when we're presenting information, you know what you're doing. You know all that stuff is in your head or the presenter's head. And sometimes I need the details. I want to know the roots of everything. So I appreciate you giving me more detail on that, and that helps.
We
Thank you.
appreciate you looking for details.
Yeah,
Don't ever
I'm a
quit.
detailed person.
Okay, no further discussion on the amendment. Let's vote on the amendment. All in favor of the amendment as presented, say aye.
Aye.
All opposed, say no. That amendment passes. On to the bill. If there's no further discussion, let's vote on the bill, please. Oh, go ahead, Senator.
Mr. Chairman, and I apologize, I didn't think about this. So this is already occurring. I mean, this entity is already formed, and yet I have an effective date of July 1st, 2024. So I'm just going to propose on the fly that we have it effective immediately date, and I'll leave it to the committee if you're willing to do that, because I didn't think about it when I was having this drafted. Thank you. There's a motion to have the standard effective immediate date.
Any discussion, opposition? Nope, let's vote on that amendment to make it effective immediately. All in favor of changing to effective immediately, please say aye. Aye. Opposed, say no. That amendment passes as well.
Thank you, committee.
Further discussion? Seeing none, Ms. Shippen, go ahead and let's take roll.
This is a, this is a roll call vote on Senate File 81 as amended. Senator Barlow, Senator Bouchard, Senator Dockstader, Senator Hutchings, Chairman Baldwin.
Aye,
We have 5 ayes, Mr. Chairman.
that bill has passed the committee. What a great committee this morning. It's only 8:45. We got 45 minutes. Okay, committee, right now, we're sitting on 3 bills for Monday. We'll get that invitation out later this afternoon. There's 2 or 3 more that may be assigned to us, but right now, we're sitting on 3 for Monday. So with that in mind, thank you very much. Yeah, we'll start at 8 o'clock on Monday. We've actually got 3 more days we can do committee work, so Monday, Tuesday, or Monday, Wednesday, Friday.
Mr. Chairman, the reason I ask about Monday is that Monday is also second reading on the budget. So I didn't know if the majority floor leader might have an earlier start time. So-
I will talk with the majority
Okay,
floor leader.
thank you, Mr. Chairman.
As opposed to today, we got lucky and had easy bills, but I will talk
Thank
with
you,
them.
Mr. Chairman.
Maybe we could start at 6. Maybe not. Okay? No, let's not take a vote. Okay,